Our next topic is acute, subacute, and chronic toxicity in animals. Now, why we are studying it? We should be understanding why we should study it. First of all, let me understand what you know about acute or subacute or chronic. Only these terms, whether anybody has seen it and what is the meaning of it. Can anybody tell? Anybody can tell about what do you mean by acute, subacute, or chronic? Okay, fine. Acute is immediate or sudden or with a very small time span. Subacute is slightly more than acute. Chronic is longer one. Okay. Now, why should we study? Yes. So why should we study it? Why we should study toxicity? Now, in last year, in second year, you have studied many drugs in pharmacology and also in therapeutics. Let me understand drugs in various ways. I want to know first about how many drugs which you have seen that they are given for short duration of time, and how many drugs you have seen that has to be given for long duration or maybe lifelong. Whether some conditions were like that. In last year's studies, have you seen any kind of drug which is given for short term only, or there are some drug which are given for some days only or some weeks only, and there are some drug which are given for a long period of time? Have you encountered? ACH is administered, Akash? Nitrous oxide. Okay. So you have categories of the drug which for last year have you studied myocardial infarction? Warfarin is not short term, it can be lifelong sadly. But even this year we have started with the drugs. Streptokinase, for how much duration it will be given? This year we have studied anticoagulants and agents on acting on blood. So streptokinase, how many doses are needed? Usually one dose is sufficient for streptokinase or alteplase. So this is the drug which is administered acutely in acute situations, and then we have seen the drugs like warfarin which can be given for long duration, we have seen. Then diuretics we have seen, it may be given for months till there is edema, they may be discontinued, but there are some diuretics which can be used in hypertension, they can be used. From this year only we can revise it. Diuretics, if they are used for hypertension, if they are part of combination of antihypertensive treatment, then it can be used for lifelong. So we have variety of drugs which can be given either for a very small duration of time, maybe single dose, only one dose, or there can be drug which are given in a repeated dose and that can be leading to lifelong treatment. So this is a big range which we are having. Now, because of that, we should understand what can be the impact it will be causing. Because when the drugs are approved for use in human beings, we should be understanding it, we should be knowing about it, that what should be the action the drug should be causing. Okay, and always there is a principle that whenever drugs are there, whenever drugs are given, so the principle of benefit is always there. They should offer more benefit than harm, and at the same time everybody should be aware how much harm they can cause, so that one can judiciously think about it. Suppose somebody asks you to do something and you are not knowing about the risk about it, then it is not good thing to ask you to do the things. Until and unless you are aware about the risk which are associated with you, then you will able to understand in better way. And therefore in every situation the person should be knowing, or the fraternity, the medical fraternity should be knowing that what will be the consequences of that medication. And it cannot be done like that. If you remember when we were discussing in earlier session, when we were discussing about or just some introductory session we started about it, and at that time everybody or many of you were writing about LD50, and in LD50 number of patients or number of subjects. And at that time we made it clear that can we use word subject or patient here, because that means for determining LD50, that is lethal dose in 50% of the population. So for determining 50% of population or lethal dose in 50% of population, can we use the human subjects there? That means we have to allow that researcher to kill 50% of the patient which are enrolled in the study. And if it is so, then as per the clinical trial practices, you should apply for that. Which government, which agency will permit you? Nobody will permit. And therefore when we go for any kind of drug, when any new drug is coming, it is very very mandatory that the drug is having a known characteristics of safety and efficacy. If it is not known, we cannot give any unknown or unidentified or unconfirmed drug. How many of you will take the drugs if it is not confirmed? If it is not confirmed that whether it has got any effect or not, if it is not known what kind of side effects it may have, if it is not known whether it can cause very very severe or lethal type of adverse effect or disabilitating type of side effect, how many of you will go if it is not known? Why everybody is taking drug, or why you are participating in drug prescription science or pharmacology or therapeutics? Because you are aware about the facts that what kind of drugs are there and these drugs are having what kind of adverse effects. So how you will come to know this? How you will come to know this? If you want to make the data of it, just like we have got latter branch pharmacovigilance. So pharmacovigilance gives you the information about the adverse effects of the drug, what kind of adverse effect the drug can cause. How will you come to know it? First thing is, before directly testing on human beings, you have to test it on animals. And when you test it on animal, whatsoever results you have found, that has to be very scrupulously, very very finely, very thoroughly verified that what kind of effects are there and what is the implication of this effect. So let us go one by one what we are going to see in this. Only 14 students so far. You people were not aware today we are taking class. So what kind of studies are being taken? So in that during research for risk assessment, many things are being done. Animal toxicology, clinical studies, epidemiology, cell tissue experiment, computational methods and other activities are there. And for that maybe academia, various agencies, they take part, and whatsoever results are there, they go for then approval process. And when everything is found correct, then it goes for approval process, and then approval process will be made, or it will be approved. Now let us go for important considerations for that. A very good definition or very good thing about drug or about poisons was told by a 16th century physician, which was an alchemist, a Paracelsus, is also called as sometime father of this medical sciences. So he told that all substances are poisons. There is none which is not a poison. The right dose differentiate a poison from a remedy. And for that examples are given. So example, if somebody takes sugar in maybe kilos or salt in kilos, that can be a poison. Even somebody takes salt, then it in a higher concentration by oral route, it can induce vomiting. So everything is a poison. The common salt which we take in food every day is also a poison. If it is taking still in higher amount, or it is injected somebody, then still it can be causing very severe problem. So even salt is a poison, even sugar which we take is a poison. So forget about the drug. You know various drugs. Have you seen the drug which are having doses, very smaller doses? If you remember about warfarin, Saili has wrote about warfarin. If you have gone through the warfarin recently, can you tell me the doses of warfarin? How much is the dose? No, Akash. Maybe okay. Actually, its tablets start from 1 mg to 10 mg. Okay. Now, what is the protein binding percent of warfarin? Yes, 99% protein bound. That means if 1 mg was the dose and even there is 100% absorption, how much drug is available for action? Because only free drug can act. Protein bound drug is not available for action. So how much is the actual effective concentration? Now you divide it by plasma concentration where it is going. So you will find that it is coming in micrograms. Now this much microgram is an effective dose for warfarin. Okay. So the dose is also important. That if some substances causes release of warfarin, then it can be a toxic. Same warfarin which was otherwise not toxic, now it is a toxic. So what are the considerations we have to think is, a poison is any substance or matter which when applied to the body outwardly or inside the body, it can destroy life by its own inherent quality without acting mechanically and irrespective of temperature. That means we are not adding agents which are acting mechanically. What are acting mechanically? Example, glass powder. Somebody consume glass powder, then we will not call it as a poison that way, because it will causing the rupture of GI or diamond, people say. Okay, and there is no temperature involved in that. So anything which is doing chemically, that are the poisons. And toxicology is the science that deals with the amount of an agent that causes adverse reaction or adverse action in living system. Acute poisons account for 10 to 20% of hospital admission for general medicine. So this is what about poisons. Now let us see what are the factors which can influencing toxicity. Absorption, we have seen that drugs can be absorbed in different way. From different routes the absorption can be different. Because of absorption, again something can be different. Example, if it is sublingual, then no first pass effect will be there. If it is intravenous, then it will be immediately going to blood. It can be pulmonary, it can be subacute, it can be intra-arterial, it can be topical, whatsoever route can be. And depending on the route, the bioavailability of the drug is changing. The bioavailability can be more or less with the different routes. Then distribution, just now we have seen example of warfarin, that is if it is protein bound, what will happen to it. Then metabolism, some are metabolized faster, some are metabolized slowly, and we know about, then same is the case with the excretion. Then what are other factors which influence toxicity? Basically plasma concentration. If you remember, we have seen it and you must be knowing about it, that we make a thing that is called as a therapeutic window. What is therapeutic window? That is, it is the range of concentration from which the action can started, that is, which will start or which will initiate the action after given the dose, and the maximum of that will be the dose after which it will cause toxic action. Okay, so once it causes toxic action, below that it should be there and it should be above the minimum therapeutic concentration. So in between this, between minimum therapeutic concentration and minimum tolerable or minimal toxic concentration, whatsoever you can call it as, or whatsoever tolerable concentration. So in that, if it is there, that is called as a therapeutic window. So in that therapeutic window, what is the viability? Because viability is played by all these ADME factors. So when it is there, and when plasma it is present in the plasma, so maybe because of accumulation it can cause, or because of slow elimination it can cause, or because of the changes in the metabolism it can cause. So there can be many reasons which are causing the toxicity. We know about this type of curve, and we know, I was telling you about this, that is minimum concentration for toxic one, minimum concentration for desired response, and this type of concentration we achieve because of the dosing. All the things you will get into in biopharmaceutics subject, wherein you will understand all this concept. We call it as this kind of zigzag type of pattern is called as a steady state concentration, and how it is maintaining steady state concentration. Then we have determined it, and we have seen various terms for this in a session earlier during introductory session, that ED50 is a dose which will cause therapeutic effect in 50% of. Here I am using now word animal very deliberately, because last time when we were using word subject it confused us. Now then next is LD50, which will kill 50% of animal of the population of the study. MED is minimum effective dose, at least the dose which is like to be effective. If that dose is not achieved, that much concentration is not achieved in plasma, then there won't be any effect whatsoever. Drug medication it has been administered, it will be useful. And maximum tolerated dose, as I was telling, or maximum or minimum toxic dose, whatsoever you call it, and this will produce the sign of toxicity. So or it is also called as the highest non-toxic dose. Up to that it will be not toxic. So we have got two lines over here. One is suppose ED50 and LD50, that gives 50% population, and then we have got MED at one bottom of ED, and we have got MTD at one bottom, at one top of the thing. So that is a therapeutic window we have got between this MED and MTD. Whatsoever thing is there, we call it as a therapeutic window. So if the drug crosses therapeutic window, any drug when crosses therapeutic window, then there will be toxicity. Now how to determine this therapeutic window? Can we, now we have seen the dose. Just now we were discussing about warfarin. When warfarin came new, suppose warfarin is a new molecule, and somebody asks you कि पेशेंट को देना है, इसका कितना डोज देना है, तो कैसा बोलोगे तुम? 1 ग्राम बोलोगे, 5 ग्राम बोलोगे, 10 ग्राम बोलोगे? हाउ यू विल टेल? If somebody asks you, you have studied pharmacology, you have studied PharmD program, you know about drug, this is a new drug, tell me about the dose to be given in human. This is totally new drug. You know the dose ranges. We have seen the drugs, they are either available in micrograms or units, heparin or insulin like agents. Then we have seen drug in milligrams, warfarin just now we have seen. We have seen the drugs like aspirin, which we have seen up to 500 milligram for NSAID use. सो हाउ यू विल डिसाइड डोज? तुमको अगर किसी ने बोला कि भाई तुम इतना पढ़े हो, फार्मडी पढ़े हो, फार्मेकोलॉजी पढ़े हो, थेरापेटिक्स पढ़े हो, तो भाई ये नया ड्रग है हमारा, उसको आप यू गिव द डोज ऑफ इट. So for that you need to have this kind of curve available. For that you need to, and can you go for ये curve, can you make it on human beings? जब ह्यूमन का डोज ही नहीं मालूम है तो तुम उसका डोज कैसे निकालोगे? तुम पहला ही डोज नहीं दे पाओगे. और अदरवाइज यू मे हैव टू स्टार्ट फॉर माइक्रोग्राम्स और पिकोग्राम्स, और भी कोई जो कॉन्सेंट्रेटेड ड्रग हैं जैसे बोटिलिन टॉक्सिन है जिसका बहुत फाइन डोज है, जिसका पिकोग्राम में डोज है. ओके, अगर वो थेरापेटिकली यूज करना है तो देन इट इज इन पिकोग्राम. एज सुन एज यू क्रॉसेस इट, यू मेक इट मोर, it is very toxic one. So in that condition how you will be finalizing dose? So for that you need to have an animal study data which will guide you for dose selection. You have seen about this, how these things are calculated, LD50s, ED50s, that gives you relative safety of drug, LD50 divided by ED50, or maximum tolerated dose by minimum effective dose, how many times you can overdose it safely. Example, barbiturate anesthesia is there, you can give maximum 3 to 4 doses. If benzodiazepine is there, you can give almost 20 times more dose of benzodiazepine. If it is penicillin, you can give almost 80 or 100 times more dose because it won't make. And standard safety margin nowadays is calculated is LD1 divided by ED, that is lethal to only one animal or 1% animal, while the effective in 99%, and it is more conservative estimate than therapeutic index. So it is dose required to kill only 1% and dose which is therapeutically effective in 99%, that gives more better safety than the previous one. And many people therefore are thinking to use, or they try to put both type of data, LD also and therapeutic safety also, or standard safety margin also. What are the toxicity? We know about adverse reaction. There are variety of adverse reaction. If you have gone through it last year, various reason A, B, C, D, E, you have seen. A means which are because of the extended action, or which is because of the action of the drug itself, maybe on more receptors, or maybe more on some receptors. And then we have seen less predictable, like hypersensitivity and idiosyncrasy, and unpredictable like idiosyncrasy, and that less predictable because of one or other reason, or multiple actions. So there are a variety of reasons why drugs can cause toxicity. So predictable, there are many, we will not go for that each and every in details. The predictable can be overdose on primary site, non-selectively acting on example, chlorpromazine can act on multiple receptors. It acts on H1 receptor, it acts on muscarinic receptor. Drug is actually meant for something else. Incomplete selective toxicity acts against host, or it causes inhibition of protein synthesis, or and such kind of antimicrobial agents are there which are acting on antimicrobial but can also cause some action on the host. Tolerance dependence develop, and because of that adverse effects are there. Immunosuppression is there which causes opportunistic infections. So like that there are many such things. Predictable are because of problems in absorption, problems in distribution, problem in metabolism, excretion, etc. So this can be pharmacokinetic drug interaction, or even because of the receptor mediated activities. Okay, these are all factors affecting or influencing the doses of drug, which you might have studied last year. So these are all the things which are actually affecting the action. And less susceptible are that is genetic susceptibility because of the polymorphism. Actually these all things you are going to study in more detail in 5th year, that is in drug interaction chapter, in pharmacogenetic chapter, or we call it as idiosyncrasy. So in all cases and in various disease conditions, suppose liver is damaged, then how the drug can be toxic, which are getting metabolized by liver. And if the kidney is having a problem or renal failure, then the drugs which are excreted through kidney, how they will get accumulated. So in that cases, what has to be done, how you have to adjust the dose, this is a whole detailed science you will get. But before that, what we need to do is, let us give then unpredictable or hypersensitivity anaphylactic penicillin. We shall be going for penicillin after various topics now. So these are unpredictable type of reactions. Now chemical forms they are producing toxicity. Example is given about paracetamol. Last year you have studied it. Paracetamol is metabolized in liver and it causes a toxic intermediate, or it is called as imine. So this imine is having free radical, and because of that free radical it can cause liver damage, or it can also cause oxidative stress. So this is how the toxicity of the drug can be there. Then induction of microsomal enzyme, and all we know about it. I will not discuss much about it. Then drugs can cause hepatitis, paracetamol, halothane, chlorpromazine. These are the drugs which can cause toxicities or hepatitis. Then drugs can cause toxic metabolites. They can cause covalent bonds. Then we have seen organophosphorus last year, which is binding covalent, and therefore they are poisons or they are causing death in people. So these are various situations. Earlier we have seen what are the reasons and why the drugs can be toxic. Now these are various sources of toxin apart from drug itself. It can be air pollution, it can from environment, it can be air pollution like carbon monoxide, fluorocarbons, heavy metals, nitrogen oxides, smoke, etc. Then because of poor ventilation, again ammonias, carbon dioxide, carbon monoxide, hydrogen sulfide, methane, etc. Then volatile compounds like chlorine, formaldehyde, etc. Then because of the food like mycotoxins which are getting into food, then from plants, some toxicants are there in some plants, particularly if it is adulterated, or the presence of pesticides or herbicides into that, presence of heavy metal because of the water which is present. And the biggest one of the important source is a drug on which we are going to concentrate at present. So I will not discuss this, how they are there and how various drugs are causing, what are their sources, what are their symptoms, and what are their treatment, because inorganic is not there, but just to tell you about various sources of toxicant. I have added it for your references, and you should be aware about it. Now we know about organic poisons. They are the drugs, barbiturates. They can cause the respiratory depression and death, or because of that. Ketamine can cause dissociative anesthesia. Last year we have studied it, and it can cause at higher doses. Then phenothiazine, like they can cause. So how to okay, this is again we are not going, because we have to go for this one. These are the general considerations of toxicology, that what has to be done if it is in patient. We shall directly move slowly towards the various conditions. So we know about drug, we know how the drug is there, and we know that when the drug has to be used, we have to fix the dose. We have to understand about its safety margin, because we have seen about it earlier that there are various drugs, they can cause various kind. Therefore we have taken all this introduction earlier, that they can cause various kind of toxicities by one or other ways. And we have seen that there are multiple type of drugs, they are having multiple type of adverse effects, and because of these different adverse effects, some of these can be relating to mortality. So acute toxicity studies, as its name is acute. Acute means usually maximum up to 48 hours. So within 48 hours, whatsoever response it is obtained from the because of the administration of the substance. We call it as a, now we will not call it as a drug now, because until and unless it passes, it will not become a drug. We will call it as a test substance at present. So any test substance when administered, those adverse effects occurring following oral or dermal administration of single dose of a substance or multiple dose given within 24 hours or inhalation exposure of 4 hours. That is the globally harmonized definition. Okay. In some cases it is studied up to 48 hours. The preferred species for oral and inhalation testing are the rat, and for dermal testings are the rat or rabbits. So these are the specific animals which are preferred for these studies. Oral administration is the most common form of acute systemic toxicity study. So now what's your results we are getting? We are calling it as acute systemic toxicity, because this is the acute systemic toxicity we have tested for. Now for that there are several guidelines are available, and these are most acceptable guidelines are called as a OECD guidelines, that is Organization for Economic Cooperation and Development. So this organization, because this is working for economic development, and while economic development it was found that at many places either food atom or drug atom or other chemical atom, if they are having this kind of toxicity things and if it is not tested, then it was causing big impact on exports or imports and all trade like things. So this organization came and they have taken the, or they have hired the experts for that, and they have made certain guidelines and which are acceptable at most of the places. There are many other things, many other organizations like ICH also, and various regulatory authorities of different countries, they are also making, but they are most common one are the OECD guidelines. You can put it in Google search and you can get various kind of such guidelines. Now what are the, it gives everything about it. What are the procedure for fixed dose type of toxicity studies? Fixed dose means one dose will be fixed. Now earlier what was the case is long back when almost this, when OECD guidelines were not that popular at that time, or they were not in much force, then at that time what was done is people were using animals, maybe mice or rats, and will take around start with 10 rats, they will give dose. If they are getting killed, then they will cause then they will go for the dose smaller than that, or if not then they will go for incremental dose. And earlier doses were not fixed. Now it gives guideline that if you know that what kind of structure it is, and you know some similar structure, so if similar structure is there and of which studies has already been done, on that basis you start with the initial dose. So give with the initial dose, and it asks only with the smaller animal first. It asks with the mice, which is smaller than rat. So it says that you go for 3 animals first, the OECD says. Now give 3 animals a comparable dose as per the structure. If it is totally new, then you are at liberty. But at least what's your basic knowledge you are having, on that basis select the dose. Once the dose is selected, give it to one animal. If that animal dies immediately, that means it is very, very toxic, you go for the lower dose. And you reach to a dose where when you give it to 3 animals, so only one is dying, or no animal is dying. If no animal is dying, then wait for 24 hours. Okay, or 48 hours, and then check the effect. And when you will able to get to that dose, when you will reach to that particular dose, then when some animals are dying and some are not dying, then you are reaching for a scientific study towards the acute toxicity testing. So these are various procedures are there, as I told you, up and down procedure. This was the up and down procedure, that at one dose you have decided, you went for that. If no animal is died, then go for slowly up by increment of 10%, 20%, it will be there in guidelines. Then, or if there is a death, then go down, okay, in the same fashion. And if it is immediate death of animal within a few seconds, then that means you have to go down by many steps, okay. Then similarly, there are acute dermal toxicity guidelines are there, that are called as a then you can go for acute inhalation toxicity, that if the drug is can be converted into volatile form, or it is a volatile chemical, then animal can be placed in a gas like chamber, and in that, along with the oxygen or other gas, it will be mixed in a proper concentration, and this will be tested. So this kind of thing are done. So you can remember these guidelines. The toxicity, this TG means toxicity guidelines 402, 403, then 420, 423 and 425. You get it on internet, and they are very big as such. Only you have to understand the gist of it, because you are not supposed to play role as a toxicologist in one or other organization, but those who are toxicologists, they have to read one by one each line, and then accordingly it has to perform, because this is very, very important and scientific data which is required for further approval of drug. So what are the consideration? Testing laboratory should consider all available information, as I told you, about the test substance. Why it is? Because I told you, if structural similarity has to be seen. If is there any other drug which has got almost similar structure or similar mechanism of action, proposed mechanism of action, then in that case, and if now those who are coming for toxicity, they will coming with certain reason, because they are not coming for testing the poison, they are coming to test for a drug. It is a drug candidate. So drug candidate cannot be an arbitrary one कि ये एक केमिकल मैंने बनाया है, हो सकता है कोई भी ड्रग हो, वो चाहे ब्लड प्रेशर में काम में आए, हो सकता है डायबिटीज़ में काम में आए, हो सकता है वो किडनी फेलियर में काम में आए, हो सकता है वो एज ए एंटीबायोटिक. वी कैन नॉट हैव दिस काइंड ऑफ आर्बिटरी थिंग. Those who have made the drug, they must have done something, they must have been some data, maybe on tissue data or some effect data must be having, and then they are going for the toxicity testing. So when they are going for toxicity testing, all available information should be made it available to the test center. जो laboratory है, for that it should be there, and it should be prior to the conducting study, because it will help the टॉक्सिकोलॉजिस्ट टू फाइनलाइज और टू थिंक द डोज. अदरवाइज वो खिलते बैठेगा, पहले एक डोज दिया सब मर गए, फिर डोज कम किया एनिमल नहीं मरे, है ना, तो वो खिलते कब तक बैठेगा. सो फॉर दैट पर्पज इट इज़ बेटर इफ समथिंग इज देयर, देन दे कैन थिंक अबाउट इट विच इज देयर. Identify and chemical structure of the substance, physico-chemical properties of this, the results of any in vitro and in vivo toxicity or any other kind of test on the substance, toxicological data on structurally related substances, already I told you about, and anticipated use of the substances. And anticipated इसलिए लिखा है क्योंकि मैंने तो स्टडी किया, मैंने जब रिसर्च किया तो मुझे मालूम है कि ये एंटी हाइपरटेंसिव है या एंटी डायबिटिक है, पर व्हेन आई एम नॉट श्योर अबाउट द टॉक्सिसिटी, आई कैन नॉट से दैट इट इज़ एक्चुअली यूजफुल, तो मैं उसको एंटीसिपेटेड बोलूँगा कि एंटीसिपेटेड एंटी डायबिटिक है, एंटीसिपेटेड एंटी हाइपरटेंसिव है. तो इसलिए एंटीसिपेटेड मैं कब एंटीसिपेटेड बोलूँगा? व्हेन आई कैन टेल इट एंटीसिपेटेड, व्हेन आई एम श्योर अबाउट सम इफेक्ट, मैंने कुछ तो इफेक्ट मैंने मेरे लेबोरेटरी में लिए हैं, देन आई कैन थिंक कि दिस ड्रग कैन बी हैविंग. और nowadays people, if have you gone through medicinal chemistry, some of the lectures in which there are new things are there, that is called as a combinatorial chemistry, and high throughput screenings are like that. So that are the newer technology where so many chemicals are synthesized, and they are related with the software structures of the receptor and chemical structures, and on the basis of conformation they are calling it as a combinatorial chemistry, and it is also called as a structure activity relationship using computer models, that is called as a modeling. So this modeling is helping, that modeling will tell you that if this drug is having this, or computational modeling, computational chemistry. So on that basis, this computational chemistry, on the basis of bond energy, bond length, etc., etc., they will, and receptor structure. So all the receptor data, their chemical structure are fed to the software, and your drug details are fed to the software, and on that basis it will able to tell you what are the chances of binding on what kind of receptor. Now if you, it is known to you that on what kind of receptor it will able to bind, then your job becomes easy. Then you can predict that if it is able to bind on beta 1 receptor, then yes, this drug can be acting as a antihypertensive through beta 1 mode. Or if it is known to act on maybe GLUT4, then you can say it is acting on diabetes. Or if you know that it is acting on various kind of protein synthesis, ribosomal proteins, then you can say that yes, it can act as an antibacterial agent which is having similar structure. So like that, this is how you can anticipate it, the use of the substance, and these all data when available, then toxicology will work. So how the study will be done? It will be selection of animal species. I told you initially it start with the mice, which is the smallest animal in laboratory situation. Then in mice it is found, then we'll go for the higher animals, and depending on the type of drug, depending on the toxicity, number of animals can be used or number of species can be used. So it can be from mice to rat to, there are many other species like gerbils are there, hamsters are there, guinea pigs are there. You go higher and higher, then after guinea pigs, rabbits are there, cats are there, dogs are there, later monkeys are there. So there are variety of species are available depending on the type of this, and as per the guidelines, up to what you have to go, accordingly one can go, and then this will be, animal species will be there. For each type of animal, housing and feeding conditions are prescribed. There are various animal ethics committees and animal ethics laws are there in India. We have got one organization, we call it as a CPCSEA. Okay, that is this CPCSEA that causes, that is Committee for Prevention of Proper Use of Animals in Research and Studies. So this CPCSA have their own inspector. They will check the all animal house conditions, housing condition, feeding condition. It needs to be air conditions. It should be getting good water. Now if it is an industry, particularly if it is a toxicological industry, then you will surprised to see the situations over there. The animals are kept in air conditions, then number of animals which can be fixed in number of given cage, that is fixed by CPSCSE for this kind of small or bigger size of animal, what kind of the cages, what kind of the condition, what should be the room size, what should be the temperature, what should be the humidity, how much amount of food, what should be the food content, what it should be very pure and filtered water. Now again in that all kind of checks are there. If AC goes off, if water is not proper, if food is not proper, that has to be checked. They should have inherent quality control about all this. Then and then animals will remain healthy, they will be proper one. Otherwise what will happen, if the animal are not properly maintained, then they can give you false results because they are not healthy. They can die early, or maybe less, they may die, they may get immune. So they must be in a proper condition so that reproducible results can be there. The animals should be prepared accordingly, and the doses should be calculated as we have seen earlier. Now administration or doses. Now if it is a dose, if it is a molecule which is from particularly herbal origin as a extract, usually it can go at a 2000 mg per kg body weight. Normally all these doses are calculated on the per kg body weight basis. So on that animal 2000 mg per kg it is given as a initial dose. If the animal dies, then go for decrease in the doses or step down process. If animal doesn't die, go for the incremental one. And one should be knowing about it, that what will be the maximum dose which will be going to be administered for human being in future, so that on that basis one can go. If it is not getting killed in maybe 5000 milligram then per kg, then normally beyond that no drug is available. We do not use any drug. Maximum drug, suppose we give 1 gram dose we are having, or maximum at the most 2 gram dose we are having of certain dose, 2 gram for 70 kg. So how much it becomes? Okay, so you can calculate it. So that means nobody is going to use at this much. Then go for main test, that is go for first is what, how many animals are killed is one thing, is that is a main test. Then go for observation. The animal has to be kept for observation for 48 hours, and in that many things are to be done. First thing is what are their observation, whether there is a change in their behavioral or their overall pattern, normally how they are walking, how their overall appearance is now, is there any change in that, is one thing. Then they are, these all animal, those which are survived or died, both, they are sacrificed. Normally we do not call these animals are killed, we call it as a sacrifice. So the animals are sacrificed by proper method, and after sacrification all their organs are checked by histopathologist. Is there anything in the liver, whether liver shows any kind of damage, necrosis like that, is there any damage in brain, is there, it shows anything in brain. Sometime blood is withdrawn at various level and the concentration is checked, and with wherever it is reaching concentration, if possible, if the advanced center is there, then they go for toxicokinetics, that if the drug is metabolized, how it is metabolized, and what toxic product it is produced, and at what rate. So this is called as a toxicokinetics. These are done. Then animal body weight is checked, whether animal has, and pathology, as I told you, all the various features on all the animals is tested. So this is how the procedure is followed. This is a very clear protocols are given, and these all protocols you will able to find in those who want to go into more details, they will able to find it into this OECD guidelines, as I told you. So these OECD guidelines will tell you about variety of such test and observation and what has to be done. But these are the minimum what I told you. I am sure you have taken down the points. These points you can incorporate in your notes and you can search accordingly. You may not get this in most probably any textbook. Very rare textbooks are there, or toxicological textbooks are very few. I am not sure whether we have anything in our library, but you have to get it from internet only. There is little chances that toxicological, this acute, chronic, and this. Then next is what data is there. So we got the data, number of animals you used, number of animal died. So you have got the graph now. One animal dose was given, was not died. 5 animals given, dose was given, how many died. And then if you are using more number of animals, then you get a proper graph at particular dose, and then you are calculating LD50 from the graph. You extrapolate it where 50% of animals are dying. Then the test report will be including following information: what was the test substance, what was the physical nature, what was the purity of that, what was the physical chemical properties, whether it is isomer, then what kind of isomer it was, whether it is D isomer, R isomer, or levorotatory, dextrorotatory, whatsoever it may be, how you can identify it, what are the analytical tools are available for that. Just like in IP you will find various assay tools or identification tools. What is appropriate vehicle, whether it is soluble in water, then is fine. If it is not soluble in water, then what kind of other vehicle it is soluble in, and in that vehicle again when it is given, then you have to keep blanks. That is, you have to administer same volume of that vehicle. Suppose now it is not soluble in water and you are using vehicle maybe propylene glycol or glycerol. Normally these are vehicles. Then you have to administer same amount of propylene glycol as you are administering drug solution. So why it is done? So that you have to confirm that the effect is not because of propylene glycol vehicle, it is because of the drug itself. Then you have to mention species and strain use. Now again species, species I told you, it can be mice, it can be rat, it can be hamster, it can be guinea pig, it can be rabbit. Now strain, if it is rat, there are a variety of strains are available in rat. Rats are available as a Wistar rats, that is called as a Wistar strain. Then there is a Sprogdale strain. There are variety of strains are available. What is the microbiological status of the animal? Now this is very important. When I told you about animal house maintenance, so in animal house maintenance you have to be very careful about it. If animal house is not hygienically maintained, then they will have microbiological some of the microorganisms are residing in the animals. So in that cases your results can be affected, or they may not be acceptable. So microbiological status is also important. Number, age and sex of animal, how much number of animals you have used, what was their age, because because animal, whatsoever animals are there in your animal house, you have to make the record of these animals. What is the gender of the animals, then what was the source of, whether your own in-house animal house is there or you procured from some supplier of that. There are many suppliers who provide very good quality and nicely maintained animals with good housing condition. So you have to mention the source of this, you have to mention the housing condition, what was the diet. As I told you, if you will find the various research papers of drug on various or even toxicological studies, you will find. You just put in Google Scholar or PubMed that toxicity studies using mice, toxicity studies using rat, then you will find these words. From where in material and method section of each kind of research article, you will find that the animals were procured or they were from their own animal house, then how the housing conditions were there, that what was the temperature and humidity, etc. Then what was the diet given. Many times they will mention the name of standard diet company's name or brand name, and at what time water was given. So everything has to be mentioned there. You will find this kind of thing. You just go for Google Scholar and you will definitely find it. Okay. Then what are the test conditions for that? Details of test substance formulation, including details of physical form of the material administered, detail of administration of the test sub, including the dosing volumes. Now again the drug was dissolved in vehicle, and because of that how much volume was given. Details of food and water quality, diet type, source, the rationale for the selection of starting dose you have to mention. Why starting dose has to be mentioned? Because I told you, if you are not sure, then you can start with some arbitrary dose. But if you know about the some history about drug, any either drug itself or its similar molecule or any molecule working in that class, then you can think about the doses, and then you will tabulate the results, data and dose level of each animal showing sign of toxicity, maybe mortality, nature of mortality, why the animals died. Again the animals, as I told you, they have to be sacrificed. So after sacrification one has to identify the cause, why the animals was died, whether the animals died because of the cardiac problem or liver problem or kidney problem or brain problem or multi organ failure or some other and severity and duration of the effect. Suppose how long the durations are there. The tabulation of body weight and body weight changes are there. What was the initial body weight, and again in all studies there are two type of things are to be there. One control is there, that is normal animal which has of same class same batch. Suppose there was 100 animals of similar cases. Now you will do that almost difference of 1 or 2 days difference in their age, or maybe 10 to 15 days difference in their age. So there are 100 animals. So in that 100 animals, what you are doing is you are having similar age, then similar body weight, okay, almost similar, maybe suppose it is almost 10 to 15, maximum 10% variation. Then again these animals, then what you do is you randomly select some animals for normal condition, you select some for blank. Blank means what? Blank means where only vehicle is given. Normal means nothing is given, and all the animals are treated in same way. Treated means in normal condition nothing is given, same food, same water condition, same housing condition. For blank, same housing conditions, same water, same food, only blank was administered. In test substances, the same volume as it was administered in blank is administered, volume is not changed. And then what are the effect? So this gives, this type of tabulation is done, and body weight change is there, and it is compared with the normal and blank. Individual weight of animal at the day of dosing in weekly intervals, thereafter and at the time of death or sacrifice is to be taken. Death and time of death, if it is prior to schedule sacrifice, if takes place, then you have to take it, why it is there. Time course of onset of sign of toxicity and whether these were reversible for each animal or not. Maybe they will appear, animal may become unconscious or something like that, it will remain unconscious, then some animal can recover, some may die, like that. And necropsy finding and histopathological finding from each animal, it is mandatory actually. And then on that basis discussion has to be written, interpretation of result has to be written, that when the studies were conducted, the final thing will come is what was the toxic dose or acute toxicity dose, what was the reason for the death, and all things are there, and what were the effects on various organs. So this whole data is collected for that. So here we finish acute toxicity testing. I hope it is clear to you. Is there any difficulty in understanding this?